Itchy vagina before period, causes and remedies. Hormonal shifts can cause vaginal itching before a period. Sometimes, however, the itching might be due to an infection, in which case the timing of the itchiness is purely coincidental. Some common reasons a person might experience vaginal itching around their period, including a yeast infection, bacterial vaginosis or BV, vaginal dryness, inflammation, and the use of certain period products. Vaginal infections are not usually serious, though they sometimes need medical treatment. People who experience itching at the same point during every cycle may have a condition called cyclic vulvovaginitis. In this video, learn about the causes of vaginal itching before a period, as well as some home remedies. Causes: vaginal dryness. Estrogen levels peak around ovulation, then fall rapidly in the days leading up to a period. This can cause vaginal dryness. Vaginal dryness may make the vagina feel painful and itchy, especially during sex. A person approaching menopause may also experience vaginal dryness. Sometimes women who have recently given birth also notice dryness while they are postpartum or breastfeeding. Inflammation. There is evidence to suggest that menstruation increases skin sensitivity. A study from 1991 found that people on day 1 of their menstrual cycle are much more likely to experience skin irritation when their bodies had exposure to an irritant stimulus than at later points in their cycle. This could be due to inflammation. Inflammation levels rise and fall during a person's menstrual cycle. Researchers suggest that this could be why some people with chronic illnesses notice that their symptoms get worse before or during their period. If a person has allergies, skin irritation, or a skin condition, it is possible that inflammation levels before a period could make their symptoms worse and cause itching. However, this is still a growing area of research, so scientists do not yet understand the common connection fully. Period products. Some people experience irritation related to the menstrual products they use. Tampons can absorb natural vaginal lubrication, making the vagina feel dry and itchy. Similarly, scented products may cause reactions in people with sensitive skin or allergies. If the irritation only happens when a person gets their period, this may mean that the period products they use are the culprit. A person can try switching to unscented pads or silicone menstrual cups. These products are less likely to cause dryness or skin reactions. Yeast infections. Yeast infections are a type of fungal infection. It is normal to have some yeast on the skin, but too much can cause an infection. Certain factors such as pregnancy, diabetes, and using antibiotics can also trigger yeast infections. Yeast infections are common and can happen at any time during a person's menstrual cycle. If the vagina and vulva are itchy and there is a thick cottage cheese-like discharge, a person may have a yeast infection. Cyclic vulvovaginitis. Cyclic vulvovaginitis is a chronic infection that reoccurs before or during a person's period. A person with cyclic vulvovaginitis may experience symptoms such as burning, itching, or stinging just before a period, symptoms that worsen after sexual activity. Few or no symptoms between periods. Several factors can contribute to this condition, including anything that changes the vagina's complex bacterial balance. Antibiotics, hormonal contraceptives, chemical products, and some chronic illnesses may play a role. Doctors treat this condition by finding the cause of the imbalance and treating the infection. Bacterial vaginosis. Bacterial vaginosis is a bacterial infection of the vagina. It is also the most common type of vaginal infection in females aged 15 to 44. Many people with this infection notice a strong fishy odor, especially after sex. Sometimes the symptoms are worse at certain points in a person's cycle, such as before a period. Some people with bacterial vaginosis notice only an odor, but others may experience itching or burning, pain, thin white or grey discharge. Doctors do not always understand what causes bacterial vaginosis. However, they do know that changes in a person's vaginal flora and practices such as douching can increase the likelihood of developing it. Sexually transmitted infections. Some sexually transmitted infections or STIs such as gonorrhea may cause itching, discharge, or an unpleasant odor. These infections do not usually get worse before or during a person's period. However, some people may notice symptoms for the first time before their period. Most STIs are treatable. If a person has any symptoms of an STI, they should see a doctor for diagnosis and treatment. Home remedies. A number of home remedies may help reduce the severity of vaginal itching before a period. However, the methods that help will depend on what the cause is. It is important to note that home remedies cannot cure STIs or serious infections. Probiotics. For yeast infections and bacterial vaginosis, probiotics may help. Probiotics contain species of beneficial bacteria and come in oral and topical forms. However, research into their effectiveness is inconclusive, and they will not cure a severe vaginal infection. Vaginal lubricants and moisturizers. Some people find relief from vaginal dryness and inflammation by using vaginal moisturizers. Moisturizers are different than lubricants because they offer long-term moisture, not temporary lubrication for a sexual activity. Prevention. A number of strategies may help reduce the risk of vaginal irritation before a period, including wearing cotton underwear, using non-irritating, non-drying period and hygiene products, treating or managing conditions that can increase the risk of vaginal infections such as diabetes. According to the Centers for Disease Control and Prevention (CDC), people who have never had sex rarely experience bacterial vaginosis, which suggests that sexual activity could contribute to a person developing the condition. Limiting sexual activity, limiting the number of sexual partners, avoiding douching, and using condoms may help prevent bacterial vaginosis. Using condoms is also crucial for preventing STIs. Using a topical probiotic or eating probiotic foods such as yogurt may help a person keep their vaginal flora in balance. However, there is not yet enough evidence to prove that this can prevent yeast infections or bacterial vaginosis. When to see a doctor. If a person has any symptoms of an infection, such as a bad odor, discharge, or pain, they should see a doctor. Infections such as bacterial vaginosis can make it more likely that a person will develop an STI. Bacterial vaginosis can also affect pregnant women and is associated with premature birth and a low birth weight. Some STIs also have long-term effects on the body and can affect a person's fertility. However, if a person only experiences irritation or itching without any symptoms of an infection, they can try over-the-counter treatments and home remedies for dryness and inflammation first. If over-the-counter treatments do not work, or if the symptoms go away and come back, a person should seek medical treatment.